Hello, guys. This is Dr. Ben Thompson with Treble Health. Check, check, check. Welcome, welcome. I'm so glad to have you here. So let's get started. All right. So this is the Fall Summit for Tinnitus Relief. Hey, everyone. Welcome. This is Dr. Ben Thompson for the Fall Summit for Tinnitus Relief with Treble Health. I'm so glad to have you here and excited to bring on our first guest speaker for the day, none other than Annie. So I'm really looking forward to uh, sharing Annie's story with you all. And Annie, I'm going to bring you up as a panelist right now. So you can check your message right there. Guys, welcome. So excited to have you here. For those who I don't know, my name is Dr. Ben Thompson. I'm the founder of Treble Health. I'm an audiologist, specialist in tinnitus, and this opportunity to come together live here on Zoom video, I think is just magical that we can all spend some time together here for the next 1 or 2 hours. Um, Quick summary. This morning we had Dr. Golenhofen and Dr. Vernizzi discuss different root causes of tinnitus and some CBT, cognitive behavioral therapy techniques. And right now we have Annie, who's a Treble Health graduate, followed by Dr. Suzanne May, followed by Jeff, who's a Treble Health graduate, and then myself, Dr. Ben Thompson. We are really excited for this. And remember that we are announcing the winner of the Treble Health Tinnitus Treatment Program, valued at over $5,000. There will be 2 times today to complete the poll, which would enter you in to win that giveaway. So, Annie, let's get started. This will be a conversation between you and will allow time for questions as well. So, for those who have not met Annie before, you may have seen her on her podcast with Treble Health, where she shared her full story. And we wanted to feature her today to go more into details of what advice would she have for her former self. Because if you're listening, you might be someone who has significant tinnitus, who needs help, and are wondering what you should do. So, Annie, welcome to the Fall Summit. How are you?
I'm doing really well.
Amazing. All
And
right.
how are you doing?
I'm doing great. This is one of my favorite times of the year to do this summit where we feature success stories like yourself. So for all of us who are here right now in the chat, I see Bob, I see Barbara, I see Devin, Galen, Jing, Carrie, Shervin. There's a lot of amazing people here. I'd like to learn where you're coming from. So put your name and where you live in the chat. Um, so Annie, everyone wants to know just generally, where are you now with your tinnitus? And where were you when this was at its worst? Give us that contrast.
Yeah, sure. Hi, everybody. Um, I'm really excited to be here. Thank you for inviting me, Dr. Ben. And right now, I am happier than I've ever been in my life. I am having a lot of joy, and in contrast to where I was when I first developed tinnitus or tinnitus, I use that interchangeable. Um, about 16, 17 months ago, when I developed tinnitus, my life was turned upside down, and I didn't know how I was going to go forward. I had severe panic, anxiety, couldn't eat, I wasn't sleeping. I really didn't know how I was going to live. So, in comparison from that to I'm happier than I've ever been in my life, 16 months later.
Congratulations. Let's go back to what your tinnitus symptoms. Um, so the loudness, the intensity, how much of your day was consumed by it. Can you give us some contrast of where you are now versus where things were at its worst?
Oh, sure. So I'll start with where it was at the worst. It was on my mind, I felt almost 100% of the time. It was, mine fluctuated. So some days it was so intense and so loud. And then I had days where it was milder and it really fluctuated. But even on those days where it was milder, I was still so panicked. because the unpredictability of it all is like, when is it going to come back? So, um, loud, um, just incredibly bothersome to almost every waking moment I felt it was on my mind and weighing so heavy to now. I was just thinking today, oh, I don't really think about it. I don't wake up and it's like not the first thing I think of. I might think of it a few times during the day. So,
Hmm. So definitely the awareness of the sound has changed dramatically. What about the volume perception for you?
yeah, so I it's not really there anymore. I didn't really put numbers for my volume. I had stayed away from that for some reason, but it was so loud, so intense to now it's a little buzz. Um, and sometimes after a long day, it's there. It can be a little annoying. Um, but yeah, very mild to none.
Wow, wow. And what was the timeline of once you started treatment, how long until you reached the end state of things where you are now, essentially, not
Mhm.
bothered by it, barely hear it. Uh, it's very mild. How long did that take for you?
Um, Probably for me, 7.5 to 8 months. Um, yeah, for it to work through those stages of habituation, the 4 stages. So, I don't, yeah, about 8 months, I would say.
Hmm. Hmm. I want to ask just point blank, why are you here? Why are you spending your time sharing your story to others?
Yeah, if I can help one person, I feel like I've done my job. I know what I went through and what I think a lot of people who are here listening are going through right now, and it's horrific. And so I want to be here to show people that if I can improve and be happier than I've ever been in my life, you can too.
Thank you so much. Well, I'm glad you're here. So let's try to share the parts of your story that could relate to others because cases of tinnitus are different based on the individual. We certainly don't have everyone follow a cookie cutter template for this is what you have to do, everyone. It's very personalized and individual. So let's highlight some of the themes that perhaps were relevant to you on the cause side of things, and then also on the treatment side of things. So, on the cause side of things, did you have a hearing loss? And if so, to what degree?
Sure. I have a hearing loss. It's mild, hearing loss in both ears, and then not so mild in the high frequency range. So that's where it's moderate to severe.
Okay.
Yep.
Okay. And then leading up to tinnitus, were you experiencing a lot of stress in your life or a sense of sort of disorder and overwhelm?
Absolutely. So I feel like my root causes are my hearing loss and chronic stress I'd been dealing with for years. I'm a type A personality and kind of a control freak, and had a few life events, tragedies in my life that kind of happened all around the same time that just, pulled the rug out from under me and I lost control. And so, yeah, I was dealing with horrible stress when it came on.
Hmm. Well, sir, I know from doing having many conversations and having consultations with patients that those two factors are probably the most common, and having them together is quite common as well. So for those listening, just know that that might be similar history, similar for you. Okay, what about other pieces? Were you able to significantly change your tinnitus by moving your head, neck, or jaw, or not really?
No, not at
Okay.
all. But
Okay, so that rules out what we call somatic or somatosensory tinnitus generally. And Annie, was your tinnitus, where did you hear it? Was it both ears? Was it only one ear? Where did you hear it?
yeah, so actually it kind of has moved around. It's both ears generally. Sometimes it feels like it's in the m middle of my head. Oddly, sometimes it feels like it's in a different room almost. So yeah, but most often both ears.
And did you ever notice the sound quality changed?
Yes, and that was scary for me because I had the kind of a high pitched hiss in my ears, and then it changed. The sound changed. And I worked with Dr. Ramsey with Treble Health, and she just assured me, yep, it the sound will change, and that's totally okay, and that's normal. So, yeah, I have a few different sounds that are part of my tinnitus.
And we have Dr. Ramsey here helping out in the chat tonight. So shout
Mhm.
out to Dr. Ramsey from Treble Health, who specializes in tinnitus treatment. Um, if anyone here has a question for Annie, please let us know in the Zoom Q&A feature, or if you're live on YouTube, I'll be checking the YouTube comments as well. And if you have a personal question about your case or general question, definitely type it in the Zoom chat. Dr. Ramsey will help answer it. Okay, well, you commented on a lot of important pieces here. Now, once you had tinnitus, what was your experience of you noticed it was annoying or bothersome, and then what happened between then and you actually starting the treatment with us? Because that's often the crisis time. What actually happened for you?
Yeah, the truly crisis time. Um, it was a trauma. It's traumatic. And so I thought it would go away after a day or two, and it did not go away. And so then I went online, and I was so fortunate, Dr. Ben, that the first YouTube video that I saw was one of yours, and also uh, Julian Cowan Hill's. So two gurus of tinnitus. So I didn't have to go through like try this instant fix. It's like I just hooked up right away with really solid help. And I did that within the first week or so because I was at my wit's end. Really was. And so actually your 7-day meditation challenge gave me hope right away. So within a week or so, I had some hope. And I took advantage of your free introductory call, which was really hard for me to reach out. I'm not a person that does that, but I took advantage of that and then hooked up with Dr. Ramsey within, it's just seemed like such a short amount of time. So within a
Yeah,
couple of weeks.
yeah. All right. So for those listening, perhaps the first thought they have is, Annie, this sounds too good to be true. I don't know if you were really struggling like I am
Oh,
because you seem so much better now. So how would you respond to that?
well, I w was in the darkest place of my life and didn't know how I was going to move forward. I was in constant fight, flight, freeze, just panic mode. My life was turned upside down, and it it, it does sound too good to be true, but it works. I'm proof of it. I didn't think that I would be where I am today, and it's beautiful.
Well, thank you. And I, what you're sharing resonates. So could you explain how you did it or what you did to get there? Um, for everyone listening, they can tell at this point that you worked with a tinnitus professional. In your case, you worked with our team and Dr. Ramsey at Treble Health. So what exactly happened? Was it the technology? Was it a medical device? Was it certain techniques with the doctor? What exactly happened?
It was all of that, and I feel like so I had my hearing tested at a local place, and fortunately, listening to you and Julian Cowan Hill from the United Kingdom, oftentimes professionals will say there's nothing that can be done, and that did happen to me. So I wasn't crushed because I knew already there was so much that can be done. So yeah, I started working with Dr. Ramsey in Treble Health, and right away, it was so hopeful. Dr. Ramsey and I worked on CBT, cognitive behavioral therapy. We developed goals together for me and things like journaling, reframing negative thinking, which I had a lot of. I didn't realize how much, but reframing was a big part of my CBT. So I would hundreds of times a day have to reframe my negative thinking. And I still use that today. I did journaling, and something that I think was really beneficial right at the beginning when I was really traumatized was looking at the wins of your day, even if they're very, very small. So small, like I took a bath and listened to some calming music, and yep, tinnitus was really bothersome. Yet I really felt I did some self-soothing, small wins, a gratitude list, and developing a list of the my coping strategies that I used. So having the goals, updating them as I progress through the habituation process, not getting on the worry train, being mindful, being in the present. Don't worry about the past. Don't, focus on the future like, oh, it's going to get worse. I'm never going to get over this. Just be in the moment. Gosh, there's so much that we did with CBT. And I think one of the things we progressed to as I was down the road in habituation, I didn't dare do this early on, but some exposure therapy where it's like, be really curious about tinnitus and be with it. It's a part of me for now. And so I would expose myself to it and just be present with it and be curious, like, oh, what does this sound like? And oh, wow, I'm listening to this. It is really bothersome and I'm okay. It's not hurting me. It's, not killing me. And did that for like 2 minutes, then 5 minutes, then 10 minutes, then longer. So that was a big thing. And things that Dr. Ramsey really helped me. She took time to know me and my particular situation and who I was, and I was very isolated when I first developed tinnitus, so I just isolated. And so as time went on, she suggested, go out with a friend, spend time with your family. All the joy went out of my life, so she like formally gave me some like build in some joy activities. So super helpful. The CBT was just a life changer for me. And then I did get the sound therapy devices. For me, I had a hearing loss, so I got the hearing aid component with the sound that comes in through the ears. And that took the edge off right away. Like it really calmed my nervous system. I mean, it didn't totally take my fight or flight away, but it calmed me enough to move forward. And so I guess that the sound rich environment was very important to me, having sound pretty much all of the time early on, all of the time. Even at night, I slept with the Oasis machine that was offered through Treble Health. If I didn't have my maskers or my sound devices in, I carried my cell phone with me and listened to nature sounds, had my fan on. It's really helpful. And then thirdly, I practice a lot of body-based practices just to get out of my head and down into my body. So that's a big part of my life now.
Well, I think that you are covering the three fundamentals of tinnitus treatment for most patients, and especially for those who have a high pitch hearing loss and some element of the central auditory brain, whether that's stress induced or the auditory filter being a little weakened and needing to be strengthened to habituate. Um, wow, what you shared are really, really important. The CBT, number one, the sound therapy devices, number two, and then number three, a more holistic or mindfulness approach. For someone who hasn't really committed to any of those yet, um, other than starting a comprehensive program, what advice might you have, or what tips would you have, in terms of really what that entails? Any other tips for them?
Sure, I feel like one of the things that I started practicing and I do now is to have really positive mantras to repeat. Positive self-talk, really helpful. Just things like tinnitus is a boring brain buzz. It won't harm, hurt, kill you. I'm okay. Of course, I'm getting better. Whatever, positive self-talk helps. I do that. So self-talk and just knowing it does get better.
Mm. Mm. I sometimes describe the treatment process as simple but not easy. So, how did you get through the 7.5 months, I believe you said? How did you get through that successfully? I mean, it seems like you have to really approach it like a marathon, right? So, how did you do that?
I it is so simple. And that's what I thought, how is this going to work? Really. And then when I had to commit to putting a lot of time in and a lot of energy. So I don't think it would be successful if you're not going to put your whole self into it, which I did. And so it is simple. The techniques are simple. It just takes a lot of practice and a lot of time and a lot of patience, which I wasn't patient with myself, and now I am. And so just learning to let go and be patient with myself and be patient with those around. Another thing that Dr. Ramsey really helped me do is to build a team, a support team, and to take advantage of that team and let the team uplift me. Yeah.
So, we have a question here, which is from Galen, and Galen asks, so if your tinnitus was partially brought on when you had high stress, then why didn't it just go away immediately after your stress improved? I'm sure you may have thought that. So what's your understanding of that?
Um, I wish it would have. Uh, but I think for me, um, I have chronic stress, and so it took me years to build up that stress, and so it's a journey to calm my nervous system, to get in a better place. So I don't, it's immediately wouldn't go away. It is a process, and it can be a long process. So I'm just being really patient with myself.
Hmm,
I wish it did go away that way, but yeah, it took me years to get where I am, so it takes a while to recover and get better.
hmm. And Annie, what is the one daily habit that you found to really help build your resilience in a stressful world? Because I assume the external stressors didn't stop. You just learned how to manage them better. So what is the daily habit that you found the most helpful with that?
Living in the present, being in the moment, not worrying about the future, and just being present right now. This is where it's at. That's been my number one.
Hmm. And do you have a body-based approach that you found to be the most helpful? I know you mentioned guided breathing and meditation. What did you find to be the most helpful there that someone can potentially pick up?
Yeah, so well, right now, part of my social goal that I had, I joined a Tai Chi class. So I practice Tai Chi, I practice Qigong, I do a walking meditation, and I can do that um, in my house, just around, just a slow walking meditation. Anything that just gets me into my body. I do a body scan meditation. Julian Cownhill has an app called Quietin that I joined, and he's got literally hundreds of different body-based exercises that he shares that I participate and I do those.
Thank you so much. And we have one last question here, which is during the treatment, did you notice linear changes or ups and downs? And what did you do when it might have seemed like you were taking a step backwards?
Yeah, so I think probably the first session I had with Dr. Ramsey, she said linear or progress is not linear. Just know that it's not linear. Um, so that was so helpful. And no, I didn't have linear success. I don't like to say good days, bad days, but a lot of fluctuations, which I don't have anymore. Um, but it was like this, and then it still was up and down, but it just got less and less and less. So um, that's how I progressed.
Okay, thank you. We're going to squeeze in one more question because this
Okay.
one's directed specifically towards you. Cheryl asked, question for Annie. Now that you have been, oh, geez, there's a lot of chats. There's a lot of chats coming in. I lost it. One second. Okay, question for Annie. Now that you've been using the techniques and practices, do they seem more automatic for you, or do you still really have to be disciplined on a daily basis with these practices?
I would say both. A lot of it is automatic now, and that's such a good question because it's like, oh, my life has changed. But I do have my practices that I work into each day that I have to be mindful of to make sure I keep that up.
Excellent. And let's share some love. Let's share some virtual round of applause and um, thanks to Annie here on Zoom. We have the hearts and the applause flowing. So, Annie, I want to give you the last word here. Um, Knowing that a lot of people here are in their habituation process or are considering starting a treatment, what advice, hope, encouragement do you have for our group tonight?
Um, we're in this together. Rely on your community. Treble Health is a community that will help you improve, and um, you've got this. You can do it. If I can do it, really, I think anybody can do it. And best to you all.
Thank you so much.
Thank
Annie,
you.
really appreciate you being here, and thank you again for saying yes to my invitation. We'll talk to you
Thank you.
soon.
Okay, thank you so much.
You're so welcome. All right, we have a quick update here. Let's check in. So there's about 100 of us here live, which is amazing. And this is the Treble Health Fall Summit for Tinnitus Relief. My name is Dr. Ben Thompson, founder of Treble Health. We are a tinnitus specialized practice where everyone on our team works exclusively with patients who have tinnitus and other hearing disorders. This means a lot to us. This is important work. Absolutely. I want to share my screen here and give a quick update on the schedule before our next presenter. Um, Today's schedule here, right now, you'll have Dr. Suzanne May, who's a tinnitus specialist at Treble Health. She is one of the most excellent tinnitus providers and specialists in treatment that I've ever met. And we are so lucky that she works on our team at Treble Health. She makes a huge difference in the tinnitus community at large, and many of the patients at Treble Health have been fortunate to work with her. So we'll have her up next, followed by Jeff, another Treble Health graduate who is one of my favorites, just has an amazing story and message for you guys. He's here already. Thanks, Jeff. And then I'll be rounding out the presentation tonight with something special that I have prepared for you guys. So, as some of you know, we are doing something unique this summit. We are offering the entire Treble Health program called the Tinnitus 180 program to one lucky winner of a giveaway. So this is our telehealth treatment, which includes the sound therapy devices on the ears to help immediately in quiet places where the tinnitus is most bothersome, but also to drive the tinnitus treatment effect over time. We also include tools for falling asleep at night and the entire package here, which includes 10 one-on-one appointments with a doctor on our team. This is our Tinnitus 180 program. It has over 1,000 five-star reviews on Trustpilot, and this is our comprehensive treatment package. From the data that we've collected, we've seen over 2,000 patients, and we have an 85% success rate, a significant reduction of tinnitus within 6 months. The value of this treatment is over $5,000. And to qualify, you must complete one of the polls at the end of the next session or at the end of my session here. So at the end of Dr. Suzanne's session or at the end of my session, that's where you can complete the poll to be entered to win. If you're someone who wants to start with us, but you don't win the giveaway, then we're offering something special as well. For the first 3 people who sign up and mention the fall summit, you will receive an exclusive 60-minute session with both Dr. Michael Gollenhofen, the ENT physician from Germany, and myself, Ben Thompson. So it'll be just us, a very small group, going into the details of your case. And I'm really excited for the three of you who decide to sign up mentioning the Fall Summit here this week. If you want to start with that, you can schedule a free consultation with Treble Health where we can review your case and then start the Tinnitus 180 program. All you have to do for that is go to treblehealth.com/consult. And I'm going to put that link in the chat right now where you can schedule a private free consultation with our team. So this summit is brought to you by Treble Health. We're so happy to be here. I'm putting the link in the chat right now on Zoom, or you can go to treblehealth.com/consult. With no further ado, I'd like to introduce our guest speaker, audiologist and tinnitus expert, Dr. Suzanne May. Over the last few years, Dr. Suzanne, who is going to turn on her video and start her presentation shortly. Hello, hello. Dr. Suzanne, how are you doing tonight?
I'm doing good. How are you?
Excellent. I'm doing wonderful. Just a quick word and a quick introduction is that if someone came to me and said, "Hey, I have a really serious case of tinnitus. I'm looking for one of the best providers, the best doctors who can help solve this problem," I would have Dr. Suzanne May here on a very short list of providers. So, with her experience at Treble Health and her own individual experience of going through severe tinnitus and treating it successfully, she has both the knowledge and the scientific backing as well as the personal lived experience. So, with that in mind, I am honored to introduce Dr. Suzanne here to be with you guys for the next 20 minutes, giving an excellent presentation. So, Dr. Suzanne, thank you so much for being here.
Thanks for having me. So, are we ready to get started?
We're ready to jump into it.
All right. We get to do my favorite topic, which is anatomy. I love talking about anatomy. When we understand what is happening in our ear and our brain, it really helps put things together when it comes to tinnitus. So, just kind of keep in mind when I'm talking about anatomy, I am talking about the ear and the brain and not our, elbows or knees or toes. So, um, see if I
Excellent.
can share
As
my
you're getting
video.
as you're getting that set up, um, what's become clear over research and over time is that when you, someone who's struggling with tinnitus, has a very clear knowledge of the connection between the ear, the brain, the emotional part of our brain, then you can master tinnitus. Even though it's tough, even though it's challenging, you know what is happening when things get better or worse, and that can help expedite the treatment. So, with no further ado, here's Dr. Suzanne May.
Yeah, it was one of the things that helped me get through my tinnitus journey was seeing, remembering the parts and the pieces of the ear and how they function. And always, if I was feeling anxious about my tinnitus, always kind of thinking about that very scientific parts and pieces would help me kind of focus myself. So we're going to start off with a general overview of the ear. And we're going to start with the outside of our ear, which is called the pinna. That is the flappy part on the outside of our ear that helps hold up our glasses and even our sound therapy devices. And as we go down the ear canal or the auditory canal, that is mostly cartilaginous, but there is part of it that's skin on bone. It is the canal that leads the sound down to the tympanic membrane. Your tympanic membrane is a membrane. When we're looking inside your ear, we're going to see kind of a clear, opaque membrane. It usually has a light that will reflect back on us when we're looking in. And this is what we see when we look in your ear. This is the barrier between the outside world and the inside world. It is something that can break, but it is also something that can heal. So when we go behind the eardrum, we have something called the middle ear space. This is an air-filled space that is containing the three smallest bones in your body, the malleus, the incus, and the stapes, which is the smallest bone in your body. It also has two little muscles, the tensor tympani muscle and the stapedial muscle. In addition, there is something called the eustachian tube, and the eustachian tube is a straw-like tube that runs from behind the eardrum down to our throat. This is what's equalizing pressure as we change altitude. So that kind of keeps things nice and equal inside our middle ear. Beyond that space is the cochlea. Now, your cochlea is The second smallest organ in your body behind the pineal gland. It is your organ of hearing and balance. So the part that kind of looks like a Cinnabon, that is your hearing part. The loopy-loops that look like a roller coaster are the part that control your balance. There are actually three what we call semicircular canals here. The third one doesn't show up because it is horizontal, so it kind of lays flat. But these canals tell us if you're going right, left, up, down, or back and forth. And then, of course, the part that we're more interested in here for at least this talk is the Cinnabon, which is the hearing portion. And then you have the auditory nerve, which is the nerve that goes up to your brain. So that's kind of our general overview of the parts and the pieces. Next, with this picture, I'm going to talk about function. So when sound comes into our ear as sound waves, I like to think of it as acoustic energy. And the sound waves are going to hit the eardrum. When that happens, the eardrum starts to vibrate back and forth and actually will convert the energy into a mechanical energy. The mechanical energy will then kind of give the bones of the middle ear a shimmy shake. They will start to vibrate. And the last little bone, the stapes, will actually physically push on what's called the oval window of the cochlea. When that happens, we now change the energy for a third time into fluid energy. Inside the cochlea is normal fluid, it's supposed to be there. And when the sound waves get to this part, they become a traveling wave. Think of like waves on the beach of an ocean, and they travel through the entire system. Also within that cochlea, there's a couple of membranes, and lining the membranes are thousands of what we call hair cells. These little hair cells are going to get like this tectorial membrane washing over the tops of them. When that tectorial membrane washes over the top of them, they will kind of bend and they will now create a chemical energy, and there will be a chemical reaction that occurs in the hair cell. The chemical energy will then now convert into an electrical energy, and the electrical energy will go up to your brain. Now, if you kept track, energy has changed 5 times by the time it has gotten to your brain. It went from acoustic energy, mechanical energy, fluid energy, chemical energy, and electrical energy. That's a lot of changes that are happening in a very short amount of time. So I like to point this out because the system is pretty complicated and we haven't even gotten to the brain yet. Now the cochlea itself is got 2 3/4 turns. It is, as I mentioned, the second smallest organ in our body. It is about the size of a pea, and it is embedded in the hardest bone in our body, which is the temporal bone, which is in our skull. What's really cool about the cochlea is that it is arranged like a piano. So at the base of the cochlea, you have all of your high frequency sounds, and then as it goes around and swirls towards the top, it is getting lower and lower frequency. So it is actually specifically arranged like a piano. This is actually a microscopic view of these little hair cells that are inside your cochlea. There are 2 types of hair cells in the cochlea. There is 1 row of what we call inner hair cells, and there are 3 rows of what we call outer hair cells. And inside the cochlea, there are about 16,000 of these hair cells, and they're all responsible for different sounds. They can work on their own, they can work together, and they can pretty much produce any sound on the face of the planet. And so it's just really, I mean, this is so small and so mighty how it can send sound. I like to point out this picture because this is kind of giving you a closer view of what we call that tectorial membrane. It's showing you how it sits on top of these hair cells. The outer hair cells are really kind of more your volume control knobs, and they're really in charge of kind of regulating the volume going up to your brain. Now, mind it, your brain does have some input to these as well, but the inner hair cell is in charge of really changing that energy from chemical energy to electrical energy. So this is just kind of a close-up view of that function there. Now, when we start to have some damage to our hearing, it usually does occur in the hair cells in the cochlea. So this picture on the left is showing you that nice normal hair cells that are there. On the right, you are seeing there is a lot of damage here. There's a lot missing from here. There's some that are clumped together. There's some that are out of shape. And this is showing you really extreme damage. This is severe to profound hearing loss because there's a lot missing. But for some of those who have tinnitus, including myself, we have normal hearing, but we actually might have some damaged hair cells that look more like this. So on the left, you have a nice normal hair cell bundle, but on the right, you will see just kind of in this upper left-hand corner here, some kind of bending of the hair cell. And if you remember from a few slides ago, if the hair cells are bent, they're creating a chemical reaction in the hair cell, which is getting converted into electrical energy. And the theory is if these are bent and broken and they're bent all the time, there could be this electrical energy going up to your brain all the time. So I do like to show that this could be damaged too. And we'll get into tests and things that we can detect this with in a minute here. You can actually have 30% damage to your outer hair cells and still have an audiogram or a hearing test that looks like this. This is a normal hearing test. Anything in that gray shaded area is considered normal. This is what my hearing looks like, nice and normal. But in other cases, you do have more commonly a high frequency hearing loss. And this is because just anatomically, when sound first comes into your ear and it's getting into your cochlea, the first part of the cochlea it's kind of hitting is those high frequency sounds. And so they're the first one to kind of get the brunt of the damage. So this is another example of a hearing test you might see where in the right-hand side of the graph are the high frequencies and they're kind of coming down. That means we're not hearing them as well. Now, if you have normal hearing and you have tinnitus, you may want to get this test done called otoacoustic emissions. It's also referred to as an OAE. Okay, so the OAE, what it does is you put a little probe in the ear and it's going to play sounds in your ear. And basically what happens is sound does get up to the brain, but there's actually something pretty cool that happens is the cochlea, and for better sense of word, kind of echoes it back out through the eardrum, out into the ear canal. And with this special little machine, this probe microphone, we can actually pick up these little emissions that are coming from the cochlea, and we can determine if there's damage to some of those hair cells. So if you have some normal hearing, you might want to get this test done. Make sure when you're calling around that you're asking for an OAE. Okay, so now we are going outside of our cochlea and we are heading up the brainstem to the brain. So at the bottom of our screen, we have two cochleas because we've got two ears. Red is your right, blue is your left. As we head up to your brainstem, there are lots of what I like to call processing centers that are along the way. The first processing center is called the cochlear nucleus. So the cochlear nucleus is basically taking any part of the auditory nerve branch, whether that's coming from the back of our neck or if it's coming from our cochlea, and it's taking all the energy from that and it's basically processing it and saying, okay, well, let me take all that information and I'm going to send it over to the other side so that guy has the information as well. But I'm also going to send it onto my own side. So what that means is the right gets the left and the left gets the right, but they also get their own side. Okay. So information does get on both sides and there is kind of crossover. When we get to the superior olivary complex, this guy's job is to say, okay, where did the sound come from? Did it come from my right ear, my left ear, or both? It's trying to determine where the sound is coming from, and it will actually physically mark the electrical signal and send it up the pathway. The inferior colliculus, that guy's job is to say, okay, well, now what frequencies are on this signal? Is it a low pitch, think of like a bass drum, or is it a high pitch, like think of a violin? Is it something within those ranges? What's on it? The other thing it does is it says, are there other non-auditory cues I could add in? For example, I saw her talk as I heard her talk. Did I smell the bacon as I heard it sizzle? Did I feel my fingers on the keys as I heard them click on my keyboard? So it's adding in that information and to the signal and sending it up the brain. And finally, we have the medial geniculate body. The medial geniculate body is deciding what to do with the sound before giving it to the brain. And what I mean by that is inside the medial geniculate body is a whole bunch of what we call relay cells. So the relay cells are actually kind of your gatekeepers here. They are determining what is the importance of the signal. Is the signal not important? I hear it, but I don't care. This would be my laptop fan, my AC vent, things that are kind of benign, my refrigerator humming. Okay. Is the sound important? I hear it and I want to pay attention to it. It is somebody talking, maybe it's my favorite song on the radio. I really want to pay attention to that signal. Okay. Or is it an alert? Is this a fire engine going by with a siren? Is it an emergency broadcast system alert? Is it something that I need to pay attention to that's going to alert me to danger? I live in California, so if I go hiking on the trails, this would be a rattlesnake rattle, right? I would want to know that sound. This is to keep me safe. So it's going to mark the signal and it's going to give it to the brain. Okay. So in the brain, we have a whole bunch of different lobes. And in the temporal lobe, that's where you have your hearing sense. And it's going to kind of process the sound that it got. Now, when it comes to tinnitus, there are a lot of factors that are coming involved here. It's usually when we hear sound, we are usually getting it with an outside source where we can see it or we have a reference for what the sound is through our lifetime experiences. With tinnitus, you don't have that. And so the first thing that the brain is going to do is actually send a signal back down to the cochlea. Remember this, guys? This guy, here it is, and say, hey, what did you send me? And the cochlea goes, I don't know. You want a sound? Here you go. Let me send it back up. And up we go, right? Gets tagged again, right? And the brain's like, oh, okay, we hear that sound again. Now remember, this is very fast. I usually like to mention like, it's as fast as touching a hot stove. Your hand has to tell the brain that, hey, that's hot. And your brain has to tell your hand, hey, move. And you can see how fast that is. So same thing here, super fast. And what happens is you have something called your amygdala. And in your amygdala, this is your fight or flight response. This is your survival mechanism. And some interesting things to know about this is very early developed on when you are a baby forming inside mom. Your sense of hearing is the first sense fully formed and functional at about 18 weeks of gestation. And the baby can hear inside mom. And about 6 months of gestation, the baby can hear some of the outside world and is starting to make some connections between if the mom has a heart of hearing a heart, like a loud sound and having a fast heart rate, that means loud is uh-oh. And so it's kind of starting to put those things together. And that's because of the amygdala. The amygdala is the brain's whole thing that keeps you safe, right? Hearing is our first sense that keeps us safe. So it activates the amygdala, and the amygdala now is going to flood your brain with stress cortisol and adrenaline and put you into that fight or flight mode. The other thing that happens is that tinnitus will now, these neural pathways will start to form all over your brain when you have tinnitus. Because your brain is trying to figure out where is the sound coming from, it will create these neural pathways. This is actually from a research study that they did, and they took a bunch of people who had tinnitus, and they actually did a very, very specialized MRI to kind of map out their tinnitus. And they saw that these little green pathways were the tinnitus, and that you could see it goes everywhere because it's looking, do I see it? Do I smell it? Do I touch it? Do I taste it? Is there something going on? So it is that response that is starting to happen in our brain. And one of the things that we do here at Treble Health is we start doing tinnitus retraining therapy, which is kind of telling you about what's happening in your brain. We also use some cognitive behavioral techniques to help kind of reframe our thoughts that are around our tinnitus. And what starts happening is we start creating new neural pathways here. We actually can take the signal and reroute them around any of these areas that are formed in your brain. We can even sprout new neurons, and the brain can start learning about what the tinnitus is, and it can start going information back down to this guy and saying, hey, we can make this, instead of a danger signal, into a more neutral signal. We might still hear it, it might still be there, but it's no longer important. And so, that is basically what's happening with your anatomy, and that is what is happening with your brain. So there you go. I hope that helped. Hope I didn't go too fast. I'm done. Where's Ben?
I'm right
Sorry,
here.
bad
Excellent job.
ending, but there you
No,
go.
excellent job. We have some questions here.
All right.
So one of the questions we have is, could you touch on what is the low-hanging fruit or the biggest opportunity for most people in terms of retraining this brain, as you say? What is the biggest opportunity to get quick gains or, an easy win if possible?
For me personally, it was sound therapy. The reason why sound therapy is so important is because it's finally giving your brain a reference point. Your brain has no reference for tinnitus, and so now we're giving it something to kind of compare. So with sound therapy, we can say the tinnitus and the sound therapy are both constant sounds. They're both sounds that don't have language, and they're both sounds that are only auditory. And so, but one we like and one we don't, right? Tinnitus we don't like. And the sound therapy we're okay with, we're neutralist. So now the brain can compare and finally go, okay, I have some evidence here, and I can start restructuring how I feel about the tinnitus.
Thank you. Thank you. And David S. has a question. Dr. Suzanne, can you explain neuroplasticity and how it relates to a possible physiological reduction of tinnitus or a treatment of tinnitus physiologically? What is neuroplasticity? How does it relate to all this?
So neuroplasticity is basically your brain's ability to learn new things. And what happens is you have these like neurons, and I like to just describe them as little roads in your brain. And what we're doing is we're actually kind of rebuilding new roads. We're getting these neurons to reroute around any problems that are happening or sprout new neurons and make new learning that is happening. So when we're doing our therapies and our coaching, that is what's occurring in our brain. But it is like having two construction workers. It takes a long time to get those roads built.
That's an analogy that a lot of us can relate to. Construction takes time, it takes a long time to build a highway. But this is leading to our next question, which is, how do you think, this is from Virgil. Virgil asks, how can I either turn down the volume or slow it down and take the edge off of the tinnitus?
So a couple things that you can try if you haven't tried sound therapy, again, I'm really going to encourage the sound therapy because that can take the edge off of the tinnitus just to give it a reference point. Other things that you can do would be, deep breathing exercises. When you deep breathe, you are lowering your stress cortisols in your brain, you are decreasing your blood pressure, your heart rate, and that is giving your brain information that you are calm, cool, and relaxed and not being chased by a bear, which your brain thinks it's being chased by a bear right now. So if you can rewrite the script by just doing deep breathing, that can help calm that level of anxiety down in your brain. So that's one thing, meditation, mindfulness, those things too.
Excellent. Thank you so much. And Martin asks, but Dr. Suzanne, wouldn't sound therapy be a constant focus on my tinnitus? I don't want to be constantly reminded of it.
No, usually it's not. It's a very pleasant sound, right? That you're hearing. Like, so I have my device on my ear right now, and it's playing an ocean wave in my ear, and that's what I'm hearing, and it's very just calming and relaxing. So I usually find it's not something that I'm focused on. It's something that usually just takes the edge off.
Excellent. Excellent. Thank you so much. And Roy asks, beyond hearing aids, what exactly is sound therapy?
Yeah, so sound therapy could be hearing aids, but sound therapy is also a neutral sound that we don't mind listening to, right? It can be a background sound, it can be an interesting sound, it can be a soothing sound, fire crackling, babbling brook, crickets, which were not my favorite personally, but I like frogs, I like whales, I like weird things. But it needs to be a sound that you don't mind having on, because that's one of the key things. It needs to be something that's not annoying to you.
Hmm. Hmm. Understood. Understood. Charlie asks, if is sound therapy effective if it's done with bone conduction headphones?
So yeah, you can do sound therapy with bone conduction headphones. That is one way to do it. You know, the for me personally, having a device that was smaller and less noticeable was definitely more useful for me, um, because I could have it on my ear and I could still work and I could still and not have people like, oh, what's that? So but you can
And
still do it with bone conduction headphones.
thank you so much. And then we have last question from Carrie. Carrie asks, if I have a pain inside my head when the tinnitus is bad, do I need to see a specialist or any advice for physical pain alongside the tinnitus?
I would say yes. If you're experiencing pain, whether that be from tinnitus or maybe something else, I would go and see either an ENT or maybe a neurologist if you're having a headache, and make sure that there's not some kind of underlying cause for the pain that's happening.
Thank you so much. And there is a question I do want to clarify. An individual asked that in most jobs you can't be listening to headphones all day. So, is it possible to use sound therapy, let's say if you're working in an office type job or around coworkers, how exactly would you do that?
Yeah, so if you're not using headphones, am I understanding that correctly, or you are using headphones?
They're not using anything, but I think they thought that the sound therapy devices might be perceived as wearing headphones from their coworkers.
Oh, they're not going to even notice it. So unless you want them to notice it. I used to have bright red, like the color of my shirt, sound therapy devices, and I would wear my hair up and no one would even notice that I had them on. So they're so small. I'm going to show you. So here's my
Let
ear,
let me pin
right?
you. Okay, your full screen. Yeah, go
Okay,
ahead.
there you go. Oh gosh, there's my ear, right? And if I go like this, boop, there you go. There's my little sound therapy device that I'm wearing right now. But you can see even with my hair up, it's not really noticeable. um, and it doesn't interfere with my glasses, and no one's really going to even know that you have it on. So
Thank you. All right, let's give our virtual round of applause and show some love to Dr. Suzanne May. And I know that many of you are waiting for the poll for the giveaway. So we're going to do that right now. Wow, there's dozens and dozens of hearts and thumbs up and applause. So Dr. Suzanne, you are free to go. And thank you so much. If you'd like to answer some more questions in the chat, please, by all means, go ahead. And thank you again.
welcome.
All right, so now it's my turn to do a quick review of the schedule and then present the poll for the giveaway. For those of you who are relatively new to Treble Health, Dr. Suzanne May, myself, Ben Thompson, we're both audiologists and we specialize in tinnitus and treating different hearing disorders. So with that in mind, I would like to introduce today's schedule. So we just had Dr. Suzanne May at 6:30 Eastern. Now we'll have Jeff, who's a Treble Health graduate, and trust me, you will want to sit down with Jeff. It, it's one of the wisest and most helpful, the patients that I've heard just share his story and help other people through the tinnitus treatment process. So Jeff's coming up right now, and then I'll be rounding out the night with a special presentation I've prepared. So we will be announcing the winner of the Treble Health Tinnitus Treatment Program, valued at over $5,000. That'll be coming up at 7:30 p.m. Eastern, 4:30 p.m. Pacific today. Um, the Tinnitus 180 program. This is our core treatment program at Treble Health, and it includes the telehealth treatment with the sound therapy devices or the hearing aids, depending on what you need for the ear device. And you would wear those devices during the treatment period. You can see this individual using the sound therapy device, able to read in the quiet living room of their house, a situation that is very hard to do if you have bothersome tinnitus without sound therapy. Additionally, falling asleep at night can be a real struggle, but having specific sound therapy devices at night, which we include in our program, is very helpful. And the core piece of what we do, it's 10 one-on-one appointments with an audiologist, a doctor from our team that's working on the fundamentals of CBT, cognitive behavioral therapy, as well as the tinnitus retraining therapy. All right, guys. So here's a quick review. We're going to launch the poll here in just 1 minute, but this is our Tinnitus 180 program with over 1,000 five-star reviews on Trustpilot, an 85% success rate, valued at over $5,000. And to qualify, I'll have you complete the poll, which I'll launch right now. So we'll take about two, take about 2 minutes for you guys to answer the questions on the poll. You should see a pop-up up here on your screen right now called the Tinnitus Poll Fall Summit 2024. Please take the next 2 minutes to answer these questions and including your contact information at the bottom. And that's how we'll be able to contact the winner of the giveaway. Here we go. We'll leave this poll up for about 2 minutes. And if you've already completed the poll earlier today, just please hang tight. All right, just over a minute left for you guys to get your answers in. So please go ahead and complete the answers on the poll. Jeff, if you can hear me, I just promoted you to the panelist position, so please accept that, and then we'll get started with your presentation very shortly.
Thank you, Ben. Okay.
Excellent. How are you doing tonight?
Good. Good to be here. And it is night, especially we have our Eastern Standard Time attendees. So it really is a good evening to everybody at this point.
Absolutely. All right, let's give this another 30 seconds for individuals to complete their poll questions. Jeff, if you could please turn on your video.
Doing that now. There we go.
There we go.
All right.
Perfect.
I look pretty.
I think you look quite handsome.
Oh, thank you. Well, with your introduction, I'm taking a deep breath. That was quite a setup, but it's good to be here.
Absolutely. All right, just another 10 seconds to get your final answers in for the poll, and then we'll end the poll. I really strongly encourage everyone to be here in about 30 minutes when I announce the winner. What we're going to do is we're going to send a text message and call the winner so that hopefully they can share some words once they receive the giveaway live with us. So that's what we're trying to do, and we'll have everyone try to be here for that, okay? All right, the poll is ending in 3 seconds. Very good. All right, with no further ado, let's introduce our next guest speaker. And I'll start by saying most patients with tinnitus, once they finish the treatment, they usually say, look, Dr. Ben, I understand it's good for me to help, but I sort of just want to move on with my life. I don't necessarily want to spend so much more time with tinnitus. But then the memories of the earlier people in their journey that helped them come to them, and sometimes individuals like Jeff, they say, "Okay, Dr. Ben, I'll share my message. I will join the summit." And I'll help other people that are earlier on in this program. So it is this sort of flywheel, this continuation process of helping other people that are earlier in the journey. And with that, Jeff has a lot of stories to share. Jeff has gone through some hardships. Jeff has now gotten to a resolution with his tinnitus that he's working hard to keep in a good place. So with that in mind, I'd like to introduce Jeff, who successfully treated his tinnitus and went through the stages of habituation. So Jeff, could you please tell us a bit about what you do or what you did for work and maybe a hobby that you have?
Yeah, sure. First of all, thank you so much for the introduction. And I feel like I'm a member of the Treble Health team in a good way. I think Annie, I listened to her and she touched on it, but that there is really something about being here and talking and sharing our stories because it is in that giving back that is a continuation of the support that and satisfaction that we can have in our tinnitus journey about helping others. Um, so I'll just close that piece by saying, as we move forward back to our new normal life, that we you don't want to spend too much time focusing on tinnitus. That's not the point. But certainly remembering and hearing Annie's story, she touched on some things I thought, wow, she went through that too. So you do feel alone in the journey. So hopefully, by our being here, for those of you who are listening and going through a difficult time, this represents hope. So, I'm in my early 60s. I know you didn't ask that. And I recently retired out of the healthcare industry. I was there for about 20 plus years, loved it, had a great job, and it was good living on the edge of my seat, urgent stuff. That was my normal thing. A lot of people would come to me, and I consider that a good stress, where it's like, yeah, no, I really love this routine I was in. And I miss my former coworkers, and so I reach out to them for just social support sometimes. And now my hobby is a musician. I've always been a home musician, and it's giving me some time now to focus on creating new social networks around music and playing music with others. Yeah.
Excellent. Excellent. So tell us about your tinnitus. Where are you now? You can use
Yeah,
any comparison you like, volume from 1 to 10, how much it affected your life. Where are you now
sure.
versus
Yeah.
where were you when this was at its worst?
Yeah, very good. I always love that question, Dr. Ben, because I think in my journey, first of all, the spoiler alert here is I'm in such a way better place than when things started for me back in, I would say, beginning in May to June 2023, where the volume and the perception just filled my head at what I would say is a 9 out of 10, and just overwhelmed me, and really made me overly concerned about a lot of things. So now, if I were to put some numbers on it, I would say perception wise, it's like down to a 2. Volume wise, it could still be somewhere at a 6 or a 7, but I don't I don't really think of it like that anymore. My whole reaction and attitude and response to my tinnitus has changed. I'm no longer in what I call a reactionary state, which I think is the sum of what Dr. Suzanne and Annie had talked about where this could bring you in the early stages, particularly stages 1 or 2.
Wow, well, that's very telling and illuminating,
Yeah.
and I think you have a lot of eyebrows and curiosity raised because if you're suggesting that the tinnitus is so much better and your health is so much better, yet the volume when you do tune into it is still moderate or still there, still strong. This is perhaps opening a different possibility of what getting better could look like. So we're going to explore that in this conversation. Let's try to connect with other people's histories here. So could you give a review of what did your hearing test find? Were you experiencing significant stress leading up to your tinnitus? Give some clues as to the potential root cause or causes in your case, please.
Yeah, sure. I'll just the short story of it is in June 2023, as I stated, I started experiencing this overwhelming ringingness, and that really scared me. And I became pretty desperate quickly, and sought out my primary care doctor about getting an audiology exam, which I did. That exam, I think, ended up being showing symmetrical mild to moderately severe sensorineural hearing loss. And so between the left and right ears, there is a loss of hearing with certain higher end frequencies. And coincidentally, I decided, because I've made so much progress with managing my tinnitus, to take the exam again in just this past October, and things are stable. I don't know if it's recommended to do it annually, but certainly it was just something I wanted to do for myself. And I think that the purpose is tracking tinnitus, and your own tinnitus is a very important thing to do. So that was the results of the hearing test.
And leading up to the tinnitus, were you going through a lot of stress or disorder in your life, or no, not really?
Yeah, I would say so. The earlier year in 2023, there were some job changes affecting job security, which led up to my retirement. It was on really great terms, the retirement. But nonetheless, when you have that going on in your job where you're not sure when the so-called axe might fall, you know, you're always going to be carrying a level of anxiety about that. And so, yeah, so I would say that I had some job related stress and worrisome going on throughout 2023.
And how about other potential factors here? Things like jaw or neck issues, medication changes. Did your ENT doctor have any additional factor as to why you have tinnitus?
Sure. So that question I see also as, what things did I try around my tinnitus? Certainly when I got the tinnitus, I was very surprised and very concerned, and I wanted it to go away immediately. So I got on I started to try to figure out, well, what can I do? What's the cause? You know, I was chasing the cause. And I'll tell you the truth, I stopped chasing the cause, because now that I know it could be a number of different things, I think what I ended up learning for myself is, regardless of any of these causes, and I'm sure there are a couple that are exceptions, the TRT program really is still applies. So in the end, where I had to really land was understanding, well, I need to stick to the tinnitus retraining therapy, regardless of what the cause was. But yeah, I had a brain MRI. I went and saw an ENT. I sought out a physiotherapist that specializes in tinnitus and jaw issues. Um, I spent time with my dentist, all of these specialists in my life that I began to investigate this with: a chiropractor, massage therapist. And so the good news there is there wasn't any underlying health cause going on that caused it. There wasn't any straight line I can draw between any factors. So, but I had
Nothing life-threatening that needed a
nothing
surgery, for
life-threatening. But
example.
I will say, for me, and I want to make a point here, is that tinnitus, in my case, happens in a larger context. It's not happening in a vacuum, meaning by itself. You know, it's affecting your whole life in these early stages, especially. So for me, I realized what Dr. Suzanne was talking about, the brain, and I was stuck in what some might refer to as flight, fight, freeze mode, severe anxiety. And I thought, boy, howdy, this is a lot. I can't, you know, how am I going to manage this? And it turned out that my thyroid level was abnormal, putting me into a hyper state. And, for those of you who might be on a thyroid medication, it takes 90 days for those adjustments to finally settle in. So through multiple dosage adjustments, that was a 9-month ride itself, alongside my having the tinnitus. So you could remove tinnitus. I would have been a nervous wreck anyway because of the
Got
thyroid.
it.
Yeah.
Got it. All right, so let's jump into your description of what actually helped you during the treatment process. Patients here, uh, people who are already working with a specialist for their treatment, or anyone who's listening who uh, just wants to get better. Um, Keeping in mind, we know some people here are actually just trying to learn, is it even possible to get better? So some people are coming from the frame of, is it even possible for me to get better? Other people know it's possible, but they need guidance on what they should do. So Jeff, could you address those two pieces first? Is it possible, number one, and then number two, what should they start doing, in your opinion?
Yeah, I don't mean to be humorous at the question, or the answer is, if you've got a brain, you're going to get better. That's the appreciation for this, is how the brain is able to deal with it. For something that is, some refer to as a benign um, sensation of the body, just making some noise. And here I am getting panic attacks about it. And I thought, well, it's not hurting me. And so it's really important to establish a sense of hope. I remember my first call to Treble Health. I didn't realize how much the emotional support meant to me during my first consultation call with Dr. Sarah, who's not there anymore, but still, it was the first time in a month that I felt a sense of hope, and of course, a positive message that you do get better. That there really, unless there's some specific reasons, I didn't count myself as an exception to where this is impossible, I'm not going to get better. And what was the second part of that, Ben, that
The second
keep
part
it
is,
on track?
once you are open-minded that it is possible to get better,
Yeah.
in your experience, what actually moved the needle? When
What
you look
moved them?
backwards, what helped you during the treatment process?
Yeah. Working working the program, the TRT, I mean, that was the other thing, the main focus. And I'm speaking from the first few months when I was in stage 1 and 2, which is a very turbulent time for me. Annie used the word dark. It got dark for me too. I was a mess. My whole world flipped upside down. And so, um, besides the hope, the messaging that Treble Health had, I knew that once I signed up, I had to trust the treatment protocol, the sound therapy. Immediately when I put the maskers on, offered another level of hope and relief that, okay, this is good. These are things are designed and have evidence-based practice behind them. So that really was my major focus, to where I had to hold on tight, do my CBT with my audiologist, and just be patient and be very kind with myself, because things don't turn around in one day. I remember Sarah told me the days are long, but the years are short. And, but telling somebody that in stage 1, that's a hard one, because you're going, I'd like to fast forward if we can, and you just can't. It's about going through it.
There's been numerous mentions of the different stages of tinnitus relief and habituation. So I want to show an image on the screen of what we call the 4 stages of habituation. Stage one being where there's the highest awareness and annoyance of tinnitus throughout the day, frequent worrying and anxiety, often stopping doing everyday activities, and sometimes accompanied by loss of sleep or appetite. So we would say that's the most severe acute stage of this. Stage two, things can get a bit better. There can be periods of time where tinnitus is forgotten or reduced in volume, start to go back to everyday activities, sleep, appetite begin to improve. There's a bit more acceptance, less annoyance. Eventually, the goal is to get to stage four. This is where the treatment is successful and your habituation is complete, where tinnitus is rarely noticed. You can quickly redirect your attention away from it, and there's it no longer elicits negative feelings or thoughts. It's very easy to forget about it. You may notice tinnitus when you're reminded of it, but otherwise, it's essentially not in your awareness, just like the sound of your breathing, the vibrations of your heartbeat, or the physical touch of clothes on your skin. The brain just tunes it out. So, Jeff, give your perspective on going through these four stages. Any advice for people who are in these first stage one or stage two?
Yeah. So for one and two, besides working the sound therapy and your counseling, there are other things you can do that have been spoken of frequently that I really invested in, and Annie spoke about these as well. And so I signed up for a mindfulness stress reduction for tinnitus online class, as you're familiar with. Is it Jennifer Gann's program? I also invested heavily in relaxation breathing exercises. And for those of you who are wondering, well, what's the prescription there? Because I've already disclosed my other health issue with the thyroid at the time, I was doing breathing exercises like 10 times a day. Anything to get my physical body into a relaxed, calm state. My objective was to calm down my nervous system and maybe send a different message to my brain, which is going crazy as if somebody pulled a fire alarm. Okay. I would say some form of exercise was good. I love walking and getting out there, reaching out for additional one-on-one emotional therapy support. So for me, in addition to the therapy that's available with your audiologist, I sought a psychotherapist outside as well, just to make sure I'm in check emotionally. And that I'm glad I did that, you know. And respecting my limitations. There's an increased need for quality sleep. I usually eat healthy, but I paid attention to that and laid off foods that do have a noticeable effect, whether it's with tinnitus or just by their very nature to stimulate or depress the nervous system, such as caffeine and sugars and the occasional alcoholic beverage. Um, Now I've gone back, I can have my coffee, and yes, sometimes the tinnitus is a little bit more present, but I know that that's normal and it's not going to hurt me. It's not harming anything. And so I enjoy those little things in life. Um, yeah.
So if someone hears this and says, "Well, Jeff, you still have tinnitus. I don't get it. It seems like you're just choosing to not care about it." Is that really what's happening here, or are there changes to the tinnitus and how your brain is processing it?
Well, I mean, to be blunt, there's no cure. Yeah, but there's also no cure for a lot of chronic conditions we go through. But what we do have is ways to manage it. And so I've heard people say, well, yeah, the one way of answering the question is, well, I just ignore it. And I don't like that. I think it's insensitive, and I think it's what we've heard from our mainstream healthcare providers that might say, well, listen, you've got the ringing in the ears. I have that too. You just learn to ignore it. And there's this big blank space in between of going, but how do I manage it? And so it's not that I don't care. Actually, tinnitus has helped me learn how to care in a number of ways. And one question that I thought I would never be able to ask myself, which is, what is positive about my tinnitus? I mean, and once you start beginning to tackle that question, you begin to flip the narrative around in your self-talk about the ringing and how to live with it and not against it. And so it is present, and I invite it in. I say, let it be. I've gone beyond acceptance. I've gone to something called allowance. Acceptance is a very, very important stage, I think really kicks in on stage 4. But when you take something further, you go into allowance and going, yeah, where's my ringing? I need you with me, so.
Jeff, I want to give you an opportunity to share some final words. Remember, there's a lot of people here who are in a position that you previously were in. What's the message that you think your former self needed to hear, especially if you're in that stage 1 or stage 2 of tinnitus?
Yeah, I'm assuming people are here because they might already be treble health patients. I don't know your audience here, but if you are, even if you're not,
It's
follow
about
the.
it's about 50-50.
Okay, great. You just I trust you guys. I mean, when I it was a very difficult search to because I ran into a lot of places online that had very disturbing messages and conversations about tinnitus. And so there are several advice I have about this. And if you're struggling in your early stages, um, you need to be patient and kind with yourself and pay attention to the CBT aspect of it. And if you feel like CBT is a little bit too mechanical or not working for you, there are other forms of therapies and support. You are weathering a very difficult time. And Treble Health and the coaching sessions that I continue to attend are very important. You are not alone. There's no need for you to isolate. I would say at those stages, you need to also work with your family and friends to let them know kind of what you're going through without expecting them to become an expert about tinnitus. And you should take that opportunity to educate yourself about tinnitus. And I could think of no better source than Treble Health, because Treble Health has done such a great job at consolidating all the information we need to know about it. And it turns out many of us probably know more than our primary physician at this point about it. But don't get passive. Don't isolate. But make sure you're reaching out to friends and family and anybody else who can work with you on consoling you. But certainly your own self-care is important.
Let's give a virtual round of applause and show our love to Jeff. Jeff, thank you for sharing this. And it really matters. It really
Yeah.
matters what you're doing here. So I really appreciate you answering my call and coming here to help serve others, and hope to see you really soon.
Thank you, Ben. Thank you, everybody. Thank
Have a
you.
good night. And if you have a few minutes, feel free to answer some questions in the chat. Thank you
Did
so
I win
much.
the car? Are you giving away a car? What are you giving away?
You you have already won the thing that people are
Thank
entering
you.
to
Yeah,
win. You've already gotten the results. So
thank you. Indeed.
I don't know if you'll be the lucky winner.
It's all, I've already won.
All right,
And
Jeff. I'll talk to you
everybody
soon.
will too who's going through their tinnitus, really. Yeah.
Appreciate you, Jeff. Thank you so
Yep.
much. All right. Well, that was wonderful, wasn't it, guys? Every time we highlight one of our success stories, it really shows the work that was put in and how there are solutions for tinnitus. I mean, think about how many doctors may have said to Jeff, "There's not much they can do. There's not much he can do. Just has to learn to live with it." Well, he did learn to live with it, but he learned to actually reduce it and improve it, and that's different. It's a very different story. All right. Well, thank you, Jeff. Guys, I'm up next, so I'll be presenting for about 20 minutes, and then we will have the final poll followed by the presentation of the lucky winner. So, um, as you know, this means a lot to us to do this summit, and I'm sharing here a presentation that I think really gets to the core message of what you guys can start doing pretty immediately. This presentation is called the Five Little Known Habits of Our Most Successful Tinnitus Patients and how many of them got relief in less than 90 days. At the end of this little class, I'd like for you to really leave with these five little known habits. And if you stay till the end, I will be announcing a way for you to get an exclusive 60-minute session with both Dr. Michael Gollenhofen, the ENT doctor from Germany, and myself. So stick around till the end for that. My name is Dr. Ben Thompson. For those of you who don't know me, I completed my audiology residency at UCSF Hospital in San Francisco. And after that, a few years later, I started Treble Health, where to date we've seen over 2,000 patients through our comprehensive tinnitus treatment program with an 85% success rate for significantly reducing tinnitus. The topics that I'll cover today are the five little known habits, the four stages of tinnitus relief, and an explanation of how to use the habits. Just a disclaimer, I would like everyone here to be medically evaluated by your ENT doctor and know that reduction of tinnitus is a gradual process. It does not happen overnight. Most people need more than 90 days to reach their end goal. All right. We've touched on this. Most doctors will say things like, there's no cure. Well, you could just try hearing aids. Try to forget about it. Just learn to live with it, or there's nothing you can do. Now, that's not true. The habits I'll describe today are really part of what we want most of our patients to be doing for their tinnitus treatment. But these particular habits are ones that stood out as maybe not so obvious, but quite effective. Randy is a patient of ours who used the habits we'll be discussing today. He had a very mild level of tinnitus for a number of years, and then his tinnitus got very loud. It jumped to an 8 out of 10 in both ears. He had severe insomnia. He was prescribed medication to help sleep. He also had some trouble hearing in restaurants, and he had never tried a treatment for his tinnitus or hearing up until that point. He reached out to us. His tinnitus on a scale of 1 to 100 was an 87, a very big problem, really a severe problem. And after following our program, in a period of about 6 months, he went from having an 87 out of 100 down to a 3 out of 100. At its worst, the constant noise was an 8 out of 10 in volume, and at its best, the end in August, after starting in March, he would have moments of quiet, not noticing the tinnitus at all. I like to highlight his story to show that tinnitus can change dramatically, and our goal for all of our patients would be to bring tinnitus down to the mild range. Through the presentation with Dr. Suzanne earlier, you learned that tinnitus is not just an ear phenomenon, nor is it just a brain phenomenon, but it's actually the interplay between the ear, the brain, the auditory portion of the brain, and the psychological stress, anxiety, fight or flight part of the brain. All of these networks are responsible for why we have tinnitus. The three most common causes of tinnitus are from the cochlea. This is the hair cells in the inner ear. Stress induced, meaning the nervous system in the brain's negative reaction to new or potentially threatening stimulus. And somatosensory. That's usually related to the physical issues of the jaw or the neck. It's important to highlight that regardless of the cause, it's the nerve activity in the brain that's interpreted as a sound. That's where the tinnitus is. And certain brain regions are highlighted as being relevant for tinnitus, particularly our emotional response and reaction, our concentration and attention, and of course the auditory brain. If you wanted a simplified version of the leading treatment and what we would recommend in most cases as a foundation of your treatment, it would be personalized coaching and sound therapy. Personalized coaching gets the brain and the fight or flight system out of that negative cycle of tinnitus, noticing tinnitus, fear and anxiety around it, increased stress, more tinnitus that continues to loop negatively and harming us. We need to stop that negative cycle, right? That's where the CBT techniques come in very well. Tinnitus retraining therapy can come in very well. On the other side, you have sound therapy. So specific medical devices or targeted sound therapy from technology you already have can be used to retrain the tinnitus response via sound treatment. So those are the two main pillars, and that's what I want to make sure you have optimized. Recovery occurs through habituation. Habituation is the natural brain process where your auditory system learns to filter out the tinnitus sound, treating it more like a neutral body sensation, less like an alarm bell, or a dangerous sound. Okay. Some common sounds that the brain already does a good job at filtering out are the sound of one's breathing, a refrigerator humming, some electrical noise from a light in your room. Those are sounds that you don't really pay attention to unless you're looking at them or you're thinking about them. So is it possible that the brain can categorize tinnitus more like that sound? And if so, will the volume decrease? Will the awareness of the sound decrease? That's exactly what we see with our patients. When they go through the 4 stages of habituation, this process takes time, but we can elicit habituation to happen in a faster and more directed way. And that's what a good tinnitus treatment will do. The end goal being tinnitus is rarely noticed, quickly able to redirect your attention away from it, and it no longer elicits those automatic negative feelings or thoughts. So some degree of habituation can happen naturally, and maybe you've noticed this in your own case where things aren't as bad as they used to be, depending on if you're just watching and waiting and seeing if it gets better. But with a targeted treatment, we can induce that habituation so it happens faster and easier. And some tools to do that would be sound therapy, professional counseling, and considering a more holistic mind-body approach as well. So what I just covered would be the foundations that I would recommend for most patients with tinnitus. Now I'll jump into these little and lesser known habits of our most successful patients. Habit number 1, having a visible list of daily relaxation strategies in your home. You can use this to keep your stress at a minimum. All right. So what should I do? What should I do today? We never want you to feel stuck like, I don't know what I should be doing for my tinnitus treatment. I don't know how I can get control over this. So having a visible list with strategies that you know how to do and that are likely to work, that is important for getting out of that fight or flight response and combating anxiety and stress. Here's a list of some great examples. And if you can take 2 or 3 of these that you're comfortable with, then you can write them down and put them on your fridge or next to your computer or what have you, in your living room, wherever, so that you're reminded that you can be doing this to train your brain and body to be in a more relaxed state in relationship to tinnitus. Probably the ones that apply to most people here would be walking outdoors, guided breathing exercises, taking a warm bath. I think almost everyone can know how to do those. But then there's some other ones: stretching, meditation, exercise, yoga, etc. When I think of someone who really mastered this and took it seriously, it was James. James is a patient who worked with us, as is everyone else who's here in this presentation. All these individuals have shared their story online via the Treble Health podcast or sharing a testimonial, and I have permission to use their pictures. Habit number 2 is observing your thoughts, feelings, and physical reactions surrounding your tinnitus without judgment. Earlier, some of you were here for Dr. Peter Vernacey's presentation on cognitive behavioral therapy. And he introduced something which is the newest approach of CBT, and that is called third wave CBT. What it is it uses non-judgmental awareness of thoughts, and it creates space between the thoughts. Then our reaction to tinnitus is lessened. Okay. So observing automatic negative thoughts you might have about tinnitus, the most common one being, I'll never get better. I'll never habituate. This is not going to work for me. I'm stuck with this forever. If you're really paying attention and aware, you often realize that you don't choose those thoughts because they just happen automatically. So your job here in this habit is to observe that thought without judgment. Acknowledge it, let it move on. This is where the breathing practices can really help, because once you connect with your breath, the thoughts tend to have a harder time to latch on. Okay. Also, if you have fear, thoughts that are related to fear, thoughts that are related to future anxiety, oftentimes fear and anxiety are both related to the future. And with tinnitus, we're worried about our future. So if you can observe that and label it, give it a seat at the table, but don't let it stay for too long. Allow it to pass through, coming back to your breathing and connecting with your body. These are great ways to observe the mind and thoughts you have regarding tinnitus. All right. Now, also, you might notice some tension in your body. Who right now, when I said tension in your body, might have noticed that, oh, your neck is stiff, your shoulders are tight, your breathing is shallow, your stomach is a bit tight and not relaxed. So those are common situations of how you carry tightness in your neck or shoulders and have shallow or short breaths. And you can observe that, those physical reactions to stress and anxiety and tinnitus. Try to observe that without judgment and settle in, breathe, ease into it, calm your body, move, and notice how this can help us get out of those anxious fight or flight states of being. Melinda is a patient of ours who did a great job at observing the mental reactions and the bodily reactions, and she took that part of it really seriously along with her sound therapy. But when I thought of this habit using these techniques, I thought of Melinda and how she used them to succeed with her treatment. In in 2020 and in 2007, there were research studies that found that professionally guided counseling was excellent for tinnitus treatment. CBT significantly reduced tinnitus-related distress when administered by a professional, and it did not have as clear of a benefit when it was self-guided. And in 2007, structured counseling led to a significantly greater improvement in tinnitus compared to no treatment or just a support group alone. So what this shows us is that, hey, this is not just a way to talk about your emotions, to vent. This is actually rewiring the brain and the connection between the auditory brain, the tinnitus, and the psychological brain in an effort to reduce the tinnitus and treat it. All right, so here's some important pieces from CBT. Notice if you have catastrophic thoughts and help respond to them by reminding yourself that tinnitus is not dangerous or life-threatening by itself. That tinnitus is not the problem, but the reaction on the tinnitus might be the problem. Reminding yourself that most people do learn how to habituate and their brains are able to habituate over time. All right. Habit number 3 is to find a new hobby to get your attention diverted and increase neuroplasticity. Once again, finding a new hobby that can divert your attention. Tinnitus may have led you to be less engaged and more solitude, but we need to shift that and get a new hobby. Think of things like an exercise routine, something that uses your hands, something that uses sound, learning how to cook, learning a musical instrument, getting an animal, journaling, writing, painting, learning a language. These are all things that we've noticed our patients who can add some new healthy hobbies are able to promote this positive neuroplasticity in their brain. John is a great example of this. He's an attorney that I worked with, and his hobby was meditation. He had never done meditation before tinnitus. Once he got tinnitus, he got introduced to meditation, and he was telling me that he was doing meditation 3 times a day. And it was helping his tinnitus. It was helping him get some sense of normalcy. It was helping him get more in control over his fight or flight anxiety response. Habit number 4, make using sound therapy a priority every day. So you've learned a bit about this today in our summit, but take this part seriously. Makes using sound therapy a priority every day. Don't just say, "Oh yeah, I turned on my a YouTube video and I played sound therapy for 2 hours. I'm doing sound therapy. It doesn't work for me." Well, that's not sound therapy. That is a good introduction, but if you're not using it yet, definitely take it seriously. Understand that about 75% of our patients are using sound therapy for 6 or more hours a day through the devices in their ears. All right. So through these sound therapy devices, these medical devices they wear on their ears, they're using sound therapy for about 6 hours. All right. So, and if one sound isn't doing the trick, then use different sounds. All right. That's really important to highlight. One sound isn't quite working for you, then use different sounds. I tend to recommend a common default sound like pink noise or natural water running, and then have some variety sounds like crickets, or on our YouTube channel, we have silk and shimmer. Those are great options. In the sound therapy devices that we commonly recommend, we have Sound Relax, which is a proprietary sound from the device manufacturer that we work with, called Widex. And these are specific mixes of nature sound plus tinnitus relief sounds. Those work very well. So I like to have some of those for our patients, and that generally leads to the best results. The best technology to use would be the sound therapy devices, which are sometimes called tinnitus maskers. But you can also use a sound machine or a smartphone app as well. Martin was a patient who worked with our team and worked with Dr. Ramsey, I believe, and he had great outcome with sound therapy. He was a bit skeptical to try tinnitus treatment at all, but after about 6 months of sound therapy, his tinnitus was a completely different symptom and condition, and he was a lot better through the use of daily sound therapy. And he did make it a priority, which helped his busy life as a real estate broker. So with decades of research evidence and more recent brain imaging studies, which showed the benefits of sound therapy, we can clearly recommend that it works for our patients, and it will work for you as well. We want a sound-rich environment during your tinnitus treatment, but once the tinnitus is treated at the end of it, you don't need to use sound therapy on a regular basis. All right. That's the goal, is to use it during the treatment period, but you don't need to use it at the end. You won't want or need to use it because if the tinnitus is treated properly, you won't need it. Habit number 5, try to replace the words that have a negative tinnitus association with neutral words. This might sound a bit simple, but if anything, you've probably learned today that this matters and this is impactful. Okay. Replacing a negative word with a neutral word for tinnitus. What can that do? Well, using more constructive phrases. So instead of saying, I'm fighting my tinnitus, or I'm fighting it, you can instead say, it's loud, it's hard right now, and I'm doing my best. Instead of saying, I can't live with it, you can try to replace that with, tinnitus is really intense right now, but I'm strong and I won't give up on this. Instead of saying, it's driving me crazy, saying, my tinnitus is loud right now. You have to repeat this. This is a habit because it doesn't work if you just do this once. But if you do this consistently over days and weeks and months, wow, this makes a big difference. And hopefully, hearing Annie and Jeff's stories tonight, you would agree with that. Toddy is a patient that I worked with where using more constructive phrases like this helped her tinnitus go from serious problem to mild and very manageable. Despite that she had a hearing loss, her hearing loss didn't change, but the tinnitus went from a serious level of tinnitus down to a mild level of tinnitus through our treatment and using these more constructive phrases that I mentioned here. So overall, those are 5 habits that you can start implementing that honestly will help you. They'll do a great job at helping you. So most of them are free, right? Most of them you can do some basic versions of yourself, and often having a professional guide you is the more effective approach. So just want to review. We talked about some current tinnitus treatment options today: cognitive behavioral therapy, sound therapy with counseling, tinnitus retraining therapy. With our team, we have the Treble Health Tinnitus 180 program. The fundamentals of all these are those 2 pieces, which are sound therapy treatment and the personalized coaching or that therapy-based approach. All right. So that's the goal, is to reduce the tinnitus. And the way we do that at Treble Health is with the Tinnitus 180 program. There have been studies like this one in 2022, which found that using sound therapy plus guided counseling led to the fastest improvement in tinnitus outcomes, better than just counseling alone, better than just devices alone. An audiologist like those on our team, what we can do when we specialize in tinnitus, we provide the sound therapy treatment with the best technology available, programmed specifically for you, for what your tinnitus sounds like, for how you hear it, and the skills to reduce anxiety, stress, insomnia, improving concentration and attention during the day with those cognitive behavioral tools. So the goal is to get relief from tinnitus in just a few months and to have a successful treatment, no matter how long it takes, getting this as low as it can go. 85% of our patients following these methods that you learned about today have significantly reduced their tinnitus. So with that in mind, I'd like to just introduce again the tinnitus treatment giveaway and have the last poll for today. So what we provide at Treble Health is the sound therapy devices or hearing aids, depending on what you need for the device, delivered via telehealth, as you can see here on the screen. Here's an example of an individual who's using the sound therapy device on his ears, and he's able to sit on his couch and read a book in a quiet space. It's soothing sounds coming in his ears. And as you know, reading in a quiet room is like the last thing you want to ever try when you're in the worst stages of tinnitus. But with the right tools in place, you can get back to that quickly, and that's what we want to see. Sleep is also important. It might be overall the most important piece and the biggest struggle for many of our patients. So we have specific protocols to follow for sleep, which includes sound therapy devices and cognitive behavioral techniques for insomnia. So here at the Fall Summit, today what we're offering is a special giveaway for the Tinnitus 180 program, which has over 1,000 5-star reviews on Trustpilot. And this comprehensive package is designed to bring lasting relief that once you're done with the treatment, the results will hold and you won't need to use anything. You'll just be back to your healthy self with a mild degree of tinnitus that's very manageable. We have an 85% success rate, and the overall package is valued at over $5,000. So to qualify here, I'm going to have you guys complete a poll on the screen. And this will be the last poll of the day. So let me go ahead and launch that right now. If you haven't completed the poll yet, this is your last opportunity to do so. You'll have 2 minutes, and then we'll go ahead and announce the winner of the giveaway. If you have already answered the poll and you have some questions for me, now is a great time to ask your questions. All right, let's give this another 2 minutes here, and I'm excited to announce the winner. All right, so as we're getting those last results in, I'll take a quick word for those who have already completed the poll that the treatment package that you learned about today, the Tinnitus 180 program, we do have this available right now. So if you wanted to start, we can get you signed up and we could start within a week. So we'd have the devices shipped to your house. I would pair you with one of our tinnitus expert audiologists on our team, and you would start the telehealth treatment, which includes 10 total appointments with your doctor, the various medical devices that we have, including the sound therapy devices, and you'd essentially enroll in the same program that you learned about today through Annie and Jeff's story. But for the first three people who sign up and mention that they were here at the fall summit, um, they will receive an exclusive 60-minute session with both Dr. Golenhofen, the ENT doctor from Germany, and myself. So there'll be three of you and two of us, and we'll make sure to spend about 20 minutes on each person's history and each person's case. And you'll get a lot of value having that hands-on attention from a prominent ENT doctor and myself, a tinnitus specialized audiologist. So to get started with that, what you can do is you can schedule a free consultation with Treble Health this week. And if you also just have personal questions about your case or are curious about our approach and what our thoughts are on your specific tinnitus, then you can sign up for that at treblehealth.com/consult. So I'm going to put that in the chat right here. If you'd like to schedule a complimentary appointment with a tinnitus expert from my team, it'll be with either myself, Dr. Ramsey, or my brother audiologist, Dr. Garrett Thompson. You can click the link right there, or you can say treblehealth.com/consult. All right, let's stop the poll here. All right, so I'm going to download the poll results. And I'll be working with Dr. Ramsey on my team here to review the poll results real quick. And then we'll be announcing our lucky winner. Dr. Ramsey, if you can work on that in the background, that would be excellent. And then if we can get our winner here, once we randomly select the winner, if we can get the winner here live potentially, if they're here right now, that'll be excellent. So guys, if you can just hang on an extra 5 minutes, we should be able to announce the winner and hopefully get some words from the winner as well. All right, so I want to add that the last time we did this, we had a patient whose name is Alex, who lives in Florida. And Alex was so surprised that he won the giveaway. He came on the Zoom. He was very emotional. He said, "Guys, I won't let you down. I'll make the most of this." And it really took me away. I was emotional about that. Fast forward about 6 months, and we see a message on our internal team on our communication platform. We see a message that Alex had graduated from our program. He was working with Dr. Brienne Schwartz on our team, and he completed the program. And his tinnitus started at a very serious level of tinnitus that he'd had for a number of months, really struggling with it. And then he started with our program, and he graduated between 4 and 6 months later with a tinnitus in the mild range, right? That's exactly what I want to see for all of our patients is a successful treatment, getting tinnitus down to the mild range, showing a significant reduction and a result that holds even when he stops using the sound therapy devices. His tinnitus is a mild level. It's exactly what we want, and that's exactly what we're going for. All right, chatting with Dr. Ramsey here behind the scenes, so give me a moment. All right. All right, so we do have the winner here, and we're going to announce that here in just a moment. Um, we have called up the winner. Um, Dr. Ramsey, can you hear me right now? I just want to confirm something real quick. Is
I
the
can hear
winner
you.
here in the panelist group? I see. Okay.
I believe so. Yes.
Oh, okay. All right. Thank you so much. All right. So after review of all the submissions, we had nearly 100 submissions. Thank you, everyone. Um, all right. So here we are for the Fall Summit. All right, so here we are for the Treble Health Fall Summit for Tinnitus Relief 2024. And after about 3 hours of presentations, guest speakers, ENT physicians, psychotherapists, Treble Health graduates, and myself and Dr. Suzanne May on our team at Treble Health, we had a poll to um, essentially give away a full comprehensive treatment for one lucky winner, one patient who completed the poll live on the Zoom call for the summit. And we received about 100 submissions, and the lucky winner is Jeff J. So congratulations to Jeff J. And I believe we have you here as a panelist. So um, Jeff, can you unmute yourself and potentially turn on your video? And are you able to hear me right now? Is this Jeff J?
Yes. How you doing, Dr. Ben?
Hello, Jeff. Great to see you here. So congratulations. You've won the giveaway, which is our comprehensive tinnitus treatment package. What are your thoughts? How do you feel?
It is awesome. I tell you what, I really don't have words to express right now. It's just it's a great blessing, a great gift. Like I said, doing this for people, what you guys do is amazing. And I've been struggling now for about 3.5 years in a real bad place with my tinnitus. I've had it for about 20 years total, but about 3 years ago, due to some loud noise exposure, I went to a real bad place with it. And like I said, it's affected everything. It's affected my life in every way. 3 to 4 hours of sleep, and if I rated it 1 to 10, I'm a 10 plus. And I could say I very seldom have a day that I would rate a number 8. So to be able to get started with you guys and go through your program is, like I said, it's a great blessing. I can't thank you all enough. It's wonderful.
Well, we love to offer this, and thank you for being here and being so enthusiastic about it. And tell us more about your situation. Tell us about what's really an urgent need in your life to improve related to your tinnitus, and what do you see as potentially happening here with this treatment?
Just hoping to get back to a normal life. You hear that from everyone, and I don't think nobody understands that until you get into this bad place of what this is and what it can do to your life. You just don't have no really type of normalcy, of any kind. And like I said, I'd just love to be able to get back to that. Spending time with my family. I have trouble just enjoying an evening of, say, sitting around watching a movie, like people would normally do, like I used to do with my family. I can't even enjoy that no more. And it's not that I can't hear the movie or I can't, it's nothing like that. It's just the tinnitus is so loud that I can't, you can't concentrate. Like I say, the anxiety is there. Before you know it, you're up and pacing, and like I said, just to have just to be back to normal. Like I said, I think as everybody says, if you could drop your level from a 10 down to a 5 or a 6, where, as you say, a mild case. I know what mild was. I lived with mild for 15 years, and I feel like I habituated to, those 15 years because I could block it out. A fan in my room would drown it out, and to get in a car and driving, down the road, the road noise, and I could, drown out the tinnitus I used to have. But like I said, when I got into this situation of a spike 3 years ago, like I said, it put me to a level that none of that stuff works no more. A fan will not drown it out. It's louder than a fan in my room. It's louder than, the car noise driving down the road. And it's this like I said, I'm in a really, really bad place. And I think, like I said, I'd really enjoy to be able to, take your program and apply it to my life. And like I said, hopefully get back to, again, what I'd like to call, a normal life, how I used to live. So I'm hoping to see from the program. And like I said, this is just a great thing for me and my family to be able to try your program and see what it will do for me.
Well, thank you so much. It means a lot that you're here and you get to share this message here to everyone. And this is exactly why we offer this, is to to help people like you who need it, and to also share it to the world that there is something that can be done. Have you ever tried a treatment approach like ours before?
No, I haven't. I actually tried Lanier last year and used it for 6 months, and Lanier just for me didn't help at all. And I'm not downing Lanier, because I know Lanier has helped a lot of people. I've read a lot of reviews, watched videos. For some people it works, and as you well know, when it comes to tinnitus, not one solution for everybody. Everybody's different of what works for them. But for me, it just did not work, and I've tried diets, I've tried fasting, I think just about anything, that's out there. I think I really have put a big effort into trying it. And like I said, I just haven't seen the relief of, again, where I'd like to get, like I said, try to get back to some normal way of living again. And so anyhow, like I said, this will be the first time I tried this. I have tried, a little bit of sound therapy with like AirPods and like, the different sounds, you can get off the phone apps, and some of those do help me. I have seen where sound therapy is a help. That just as I've listened to you today speak, doing it for a couple hours a day, as you can tell, it is some relief there, but it's not enough. I could see where it's something a guy would have to do, just about around the clock, I think, to try to retrain the brain. And that's something I haven't, went that far in doing, but I look forward to be able to do that now. I hope I will be able to do that here with your program, and like I said, with something
Absolutely.
to keep that noise at bay, and so that's what I'm really excited about trying.
All right, well, we'll work hard to get to a better place and to slowly but surely reduce this tinnitus and get your life back to its new normal, or as close to normal as we can. All right. All right. Big hug from us. Thanks, Jeff. And yeah, so how this will work is we'll get things set up, and we should get those devices out to your house in the next week, and then start the treatment. Have you work with one of our audiologists, okay?
That sounds awesome. I thank you so much, Dr. Ben. Thank you for, like I said, for this, and not only this, like I said, for what you're doing to help people with this awful illness. Like I said, people they just don't know. A lot of people don't understand unless you've had it, and like you said today, a lot of the ENT doctors, we've all went to, we experienced the code word of, you just have to learn to live with it. There's nothing we can do. And those things are scary to hear, and like I said, and when you see there's a business out there like yours, a clinic that's saying, hey, there is an option, don't give up. I guarantee all of us need to hear that. So again, thank you again for what you're doing.
Absolutely. All right, Jeff, we'll see you soon. All right.
All right. Thanks again.
Thanks, Jeff.
Bye-bye.
All right, guys. Well, that's a good wrap. That's a good place to leave it. You guys know how to find us. Just reach out to us at Treble Health if you want to speak with anyone on our team. Otherwise, take care of yourselves, and thanks for being here for the Fall Summit 2024. Be well.
Well, I say we're at the top. I don't know if they're